Hi, everybody. Ann Louise Gittleman here, back with the First Lady of Nutrition podcast, where I interview all of the biggest nutritional stars in the industry. And today I have one that I think you're going to really, really enjoy. His name is Dr. David Watts, and he has more credentials than almost anybody that I've interviewed. He's one of the top biochemists in the country and is also the co-founder of Trace Elements, Inc., which he established in 1984, which is a federally licensed clinical laboratory specializing in trace mineral hair analysis. So welcome to you, Dr. David Watts.
Thank you. Thank you for having me.
Okay, so let's just jump into the far end of the pool. Why is hair analysis so important in this day and time? Why is hair analysis better than a blood test for heavy metals?
Well, it will show us the indications for an accumulation over time, whereas the blood will just show us what a person may have been exposed to just a short time ago. But you can be exposed to lead from several years ago, and it can still be in the body, which will manifest in the hair analysis test, where it may not show up at all in the blood test.
So how accurate is a tissue mineral analysis? You know, people will say they've sent the same lock of hair to three different hair analysis laboratories and sometimes get three different results. How accurate is your tissue mineral analysis?
Well, it's extremely accurate, and many of those have been misinterpreted. When they send us a sample to 2 or 3 different laboratories, they don't understand the difference in the reporting of those different results. Some labs report in parts per million. We report in milligrams percent. And so it's a factor of 10. So if someone reported a calcium from one lab of 170, that would be actually 17 milligrams percent. So that's a lot of the confusion. And then the other instance, they could improperly separate those samples and use long hair on one test and shorter hair on another test. And that would, of course, provide some skewing of the data. But overall, there should not be that much of a difference. And we don't really find that much of a difference, except, when the sample's not taken properly or it's using a different laboratory technique in reporting intervals.
So I was looking over your marvelous credentials, and they're quite impressive, to say the very least, Dr. David Watts. But what I'm interested in knowing is how you became involved with hair analysis. What made you get into the business in the first place?
Well, I was in nutrition, for many, many years, and I used to, follow all the great nutritionists back in the day. And you know them all as well, I'm sure, Adele Davis and Carlton Fredericks and so forth. And so I was really interested in how nutrition could help people. And but I would use nutrition, and I saw, in different cases, and I saw some people would get better, some would get worse, some wouldn't respond at all. So I thought, well, it's not individualized enough. We need a test to be able to tell us specifically how we can target that individual's need, not based on their symptoms, however, because, we found through hair analysis research, that there's a dozen different patterns associated with developing diabetes. So you can't treat a person as a diabetic. You have to treat that individual who has diabetes and pinpoint their needs, and therefore you can get a greater, better response than just sort of shotgunning it or giving them all the nutrients and expecting them to use, what nutrients they can and eliminate what they don't. And then, of course, minerals are more important than the vitamins, because minerals are enzyme activators, and vitamins act in concert with minerals, but they're, cofactors. And so the minerals are really, the things that have to be corrected for everything else to be utilized, including proteins, carbohydrates, sugars, and so on.
So you're making a point that I think is really well taken. You can actually analyze patterns of health or patterns of health that may be leading to some kind of disease early on. So what do you particularly see with diabetes, for example, with heart disease would be another one, and even Alzheimer's, if you can just briefly tell me. And I think this is a good time to let all of my listeners know that this podcast is sponsored by UniKeyHealth.com. And UNI KEY Health has been my go-to distributor for over 25 years. They actually offer hair analysis through your company, and we do so with a private consultation as well for those that are in need. So thank you, UNI KEY Health, and let's proceed. Patterns of health, Dr. Watts.
Well, let's just use diabetes as an example. You have adult onset diabetic conditions, which is called, type 2 diabetes. You have infantile or juvenile diabetes called type 1 diabetes. Now, those are two different causes, or patterns associated with that, with diabetes, right? One, however, the type 1 is typically found in children who don't produce insulin, whereas the type 2 diabetic patient, adult onset, they actually have an overabundance of insulin, but they're just not utilizing it. And then what we have to do then is analyze why, or look at the mineral patterns and see why they're not utilizing that insulin properly on a cellular level. And that can be any number of things. That could be, excessive copper levels, zinc deficiencies, chromium deficiencies, and so on. And so that just gives you an example of the many aspects of that we find in diabetic patients. And in cardiovascular patients, we typically see that in our fast metabolic types, the sympathetic types that you're familiar with. Maybe some of the listeners aren't. But it just means a person who has a overactive metabolic activity, and therefore their blood pressure can go up just as a result of that. And that's typically associated with severe magnesium deficiencies. Magnesium is known to, be related to hypertension and can obviously diminish under stress. And then the stress causes high blood pressure, and then the stress causes the loss of magnesium, and the lack of magnesium actually enhances the stress response. So it's like a vicious circle there that needs to be stopped. But the other probably major cause, for another type of diabetes is the metabolic syndrome. And this is associated, again, with a fast metabolic pattern, but the most common factor that we find in those individuals is severe copper deficiencies. And when there's a copper deficiency, there's an increase in lipid peroxidation and tendency toward atherosclerotic conditions and increased fat circulating in the blood. And they have insulin antagonism rather than insulin resistance. And so one of the major factors contributing to that copper deficiency in those people frequently has been with supplement intake, taking too much of something that would antagonize copper, like too much zinc or too much niacin. Those both antagonize copper, but the biggest food antagonist of copper is fructose. And so many people consuming high amounts of fructose are actually contributing to copper deficit and then contributing to not only the metabolic syndrome, but also cardiovascular disease.
And tell me what you're seeing, or perhaps you haven't noted. We're getting so many people with autoimmune illnesses, whether it's MS or lupus or ALS, and then, of course, there's the dreaded Alzheimer's. Are you seeing any early indicators that could be red flags for these types of illnesses?
Oh, absolutely. We have categorized many illnesses, into these metabolic categories. And so, the most common overactive immune response or autoimmune condition is seen, or it's seen in women more commonly than males, right, by a factor of like 7 to 1. And so that's typically seen in your slow metabolic individuals, which largely make up the population of women, compared to men who are fast metabolic types. And so they have hyperactive immune systems that's actually producing harm to the body rather than protecting themselves from the condition that they have. And these can be triggered by mineral imbalances, and they can be triggered by other illnesses, coexisting illnesses, such as a viral condition. Many times we've seen autoimmune responses triggered by a virus, and they never knew they had it. It could be underlying subclinical and contributing to an overactive immune response. And as far as Alzheimer's, one of the main things that we see with that is stress. It's stress-related, typically a hyperactive adrenal cortical activity. And when that happens, the stress hormones being so high for so long, they'll become quite destructive rather than helpful. And that is another type of autoimmune response, which is seen in the fast metabolic types. And the stress hormones being so high for so long, leads to brain shrinkage, and then the neurofibrillary tangles and amyloid plaques in the brain, and that could be a major contributor. Of course, other mineral deficiencies can too, like a copper deficiency. Copper, is necessary for normal neurological functioning, particularly myelinization of the nerve fibers, and it also impacts your dopamine levels and so forth. And so many people with copper deficiencies also have a corresponding relationship to conditions like Parkinson's disease, which is related to dopamine imbalances, which is related to a copper deficiency because copper is necessary for production of dopamine.
So it's looking to me like many of these minerals, Dr. Watts, and this is a loaded question, which I know you're very qualified to answer. Many of these minerals act as double-edged swords.
Oh, that's exactly right. Like I say, the minerals, they do work together in pairs, but in excess, they can become antagonistic to each other. And that's where if somebody is taking a supplement or a vitamin or a mineral, they could be doing more harm to themselves than good if they don't have some type of a roadmap showing them what they need to target and what they need to give up. Many times the mineral analysis can be used to tell a person what they shouldn't be doing rather than what they should be doing. And many times when we get them off of supplements that are detrimental to them, they do a lot better, without even supplementing the things they need.
Interesting. And I also want to bring this to your attention because I found this very interesting. I was approached by a very, I'd say, avant-garde researcher, Dr. George Brewer. I don't know if you're familiar with him, at the University of Michigan. And he had noted an article that I did. It was a lay article on the dangers of copper and hyperactivity among women. And he's been doing some interesting research correlating Alzheimer's with the introduction of copper pipes in the homes of Americans during the early 20th century. So he's a believer that we need to actually filter our water to protect against this particular inorganic copper, but he's also against taking copper supplementation and believes that the only kind of copper we should be taking is from food sources. What do you believe about that?
Well, I think he's right. The majority of the population, fall within that slow metabolic category. About 70% of the U.S. population, can be considered in the slow metabolic category, and the other 30% are fast metabolic types. So the majority of people, yes, they should not be taking copper arbitrarily. And yes, the copper pipes have been a major contributor, to the copper accumulation that people have. And it's not so much that they take in more copper than others, but the problem can be that they can't eliminate it properly. And it'll build up in the body, even though they may be taking less than, or consuming less than someone else does, So that's the major factor. And the main eliminated organ, is through the liver for copper. And as copper builds up in the liver, it causes reduction in liver function. And it also causes stasis of the gallbladder, so there's not complete emptying. And this is why many women, who get high copper due to high estrogens as well, will cause an accumulation. If they're taking it in from the water pipes, their estrogen levels are high, and they're going to retain a lot more. And when that stasis occurs in the gallbladder, that's why women have such a increased incidence of gallstones compared to men. And it's so common for that to occur following a pregnancy when copper levels naturally rise, during pregnancy.
Interesting. So what would one do? I've seen a lot of copperheads when I analyze the hair analysis that we get from UniKeyHealth.com. And I would say perhaps 60 to 70% of all the people that do hair analysis from the female population are very copper toxic. And I don't know if that's the correct word. There's a copper dysregulation. Perhaps that's more appropriate. So what would you recommend for those individuals, either who have high estrogen or high copper?
Yeah, I'd like to call it a copper burden because, the...
copper burden, I have to quote you on that. That's good.
Only because, you can have elevated levels that are not a toxicity per se, because that's more of a, severe term, like you would have to have immediate attention to that. And it's not like we're talking about Wilson's disease where they have, buildup of copper in the liver and the brain to the point that they're having, severe disturbances. So we're talking about, in general, populations having an increased burden of copper from all the sources you mentioned. And obviously, one of the first things that we need to do is to look at their diet and make sure they're not consuming a lot of high copper foods. And, one of those is soy products. And, how soy was promoted some years ago, for its actually, it was being a phytosteroid, but they failed to look at that copper level in the zinc copper ratio. And so we want to increase foods, that would reduce copper burden, like high zinc foods. And then, of course, anything else that lowers copper from a supplement standpoint would be beneficial, such as such as vitamin C, vitamin A, niacin. And,
molybdenum, and I love the molybdenum.
And molybdenum, yeah. And also, that brings up a good point, with a molybdenum deficiency, there's an inability, for the body to detox.
So the other thing that I'm finding with copper and this connection that we're seeing with all of these diseases is that a lot of the foods that people are veering towards, the plant-based foods, are also exceptionally high in copper, very low in zinc. And I'm looking at avocados. I don't think people are as engaged with soy anymore. I think soy has gotten a pretty bad rap these days. But certainly avocado, nuts, and seeds are using nut flours instead of gluten-rich flours. They're using a lot of coconut. They're using a lot of sunflower seeds, a lot of cashews. They're all exceedingly high sources of copper, as well as tea. Could you speak to that a little bit?
As far as tea?
Yeah, tea being a source of copper.
I'm not aware of that.
Yes, many of the black teas, the green teas, the white teas are sources of copper as well as fluoride, which I think is an interesting combination. But something that I also think would be important to bring up is that in a lot of my interviews that I've done with some of the autoimmune docs, they say that mercury is a big deal when it comes to autoimmunity. Have you seen that to be true?
Oh, yeah, that's one factor. It's not uncommon, when you have those extreme slow metabolic patterns, particularly those people with high copper. See, their metabolic rate is markedly reduced for a number of reasons. One is their metabolic rate is low because of the high copper, because copper also suppresses, liver function, and it also suppresses thyroid function and so forth. So they have a very low metabolic rate. And I think, regarding the tea that you mentioned earlier, see, the fluoride in there is a big significant factor in slowing down that metabolic rate as well, and the ability for the body to actually, detox itself.
Yes, and I have suspected for many years that this increase in the green teas, the black teas, and the white teas that are out there, particularly the green teas, is one of the reasons that so many people are hypothyroid. So what else are you seeing with hypothyroid particularly? We're seeing a burden of copper perhaps and mercury. Are there any other heavy metals that are getting stuck in the thyroid?
Yes, and I forgot to mention the mercury part of that you were saying earlier, alluded to earlier. The mercury is not uncommonly elevated in people with low thyroid and high copper levels, and seems like those two go together frequently. And so it's very difficult to ever get that mercury out until they get the copper low. But other things can contribute to low thyroid activity, such as elevated calcium levels.
Oh, that's a big, let's talk about that. People just do not realize. So something that I have learned from you, and I believe Dr. Watts, that we both studied with Paul Eck many, many moons ago. Am I correct in assuming that?
Yes, Paul and I worked together.
Okay, so I am correct. So I learned many years ago, because he was such a kind of a genius in the field of minerals, many years ahead of his time, that calcium had a slowing effect on the thyroid, whereas potassium had an enhanced metabolic effect. Am I correct in assuming that? Is that still true today?
Oh, yes, it certainly is.
So let's talk about the calcium conundrum, because I'm one of those individuals that actually needs a little more calcium. I have very low blood calcium, which is also a signal for sensitivity to electromagnetic fields, which I've just learned. So I'm kind of hypocalcium. But for those that have too much calcium, what can it signal in the body? What is the dangers of a high calcium content? A high calcium burden, excuse me, I'm using your new terminology.
Well, as calcium builds up in the body, to excessive amounts, then it disturbs the relationship between its synergistic or cofactors, like phosphorus, for example. See, calcium and phosphorus work together, correct? They're necessary in the proper balance to build strong bones and teeth. But if the calcium gets markedly elevated relative to phosphorus, then one of the factors contributing that'll contribute to is osteoporosis. They'll start losing bone density. They'll start losing dental integrity, and because of that antagonism to phosphorus. And so, but many people for decades, particularly women of a certain age, they'll be put on calcium as a knee-jerk reaction because, oh, you're in your 50s and you're a female, you need to start taking calcium. And many of those people start developing hypothyroidism from taking all that calcium, and then they're treated, with thyroid support, and they rarely respond until they stop taking the calcium supplementation. And so, but calcium also, antagonizes other minerals such as iron, and iron deficiency is associated with low thyroid, fatigue, depression. So the symptoms are very, very, very similar. And so, also an excess calcium level, if it's acquainted with a magnesium deficiency, will start causing calcium deposition in the soft tissue. And so when it, builds up to the point that it's in the skin itself, you get an increased layer of dry skin, wrinkle skin, and poor hair texture, and so on. But obviously it can build up in joints, lymph nodes, and arteries. So it has been linked, all the calcium supplementation over the past decades have been linked to increased calcification of arteries in females.
But didn't you also once write, and you have a book, tell me the name of that book. It's a wonderful little blue book. What's the name of that for my listeners?
Trace Elements and Other Essential Nutrients.
Is that still on the market?
Yes.
Oh, excellent. And where can people get that book?
At traceelements.com or Trace Element Labs.
Excellent. I just wanted to give you that honor because it was such a wonderful little booklet and still very apropos today. But didn't you once write, perhaps it was there that I read it, that high calcium is also a signal for high virus? Yes.
Calcium, it is associated with viral conditions, people with underlying viruses and so forth. And it's been found that, when they take a dormant virus and they put it into a medium, and they subject that to increased amounts of calcium, then the dormancy of the virus they start becoming active and start proliferating. Okay, but then when they lower the calcium concentration, the viruses go back to being dormant again. And so anything that would reduce calcium, or I should say, first of all, anything that raises calcium can increase viral susceptibility. And most people with viruses have high tissue calcium levels. Okay, so it goes together. And so the environment for the virus is there, and until you bring that calcium down, there's always going to be that potential. And the most common viruses that we see with people with very high copper levels are like cytomegaloviruses and EBV, Epstein-Barr viruses. And of course, as you know, those viruses are contributing to a lot of conditions that we've seen in the last couple of decades that we rarely saw before, such as chronic fatigue syndrome, fibromyalgia. So excess calcium contributes to those things as well. And so reducing calcium would help to reduce the viral susceptibility. And what's a mineral that is antagonistic to the calcium? Well, phosphorus is, obviously, right? And then also magnesium.
Yes, the two biggies, the dynamic duo.
Yeah, magnesium helps to reduce or improve calcium utilization. And with a magnesium deficiency, even if you take an abundance of calcium, you never can replenish the bone stores unless that magnesium is replaced first.
So are we seeing, we're in the age of virus, certainly, so this is extremely relevant. We're in the midst of a pandemic, and we may be seeing new viruses coming down the pike very soon. So what should people watch out for? So as a general rule of thumb, they should decrease their calcium supplementation to maybe 500 milligrams a day, or better still, get most of their calcium directly just from food. Would you suggest that as a number one strategy?
Yes, in general, since 70% of the population are in that slow metabolic category, that would be a good generalized thing to say is that they should get it from their food sources and not necessarily be taking a calcium supplement.
So all right, so then that would mean your fermented foods, if you can tolerate them. I love the yogurt particularly. I like even a little bit of cheese. A little bit of cheese goes a long way. A low-fat, maybe cheddar would go a long way. Low-fat Swiss because of the high AGE, advanced glycation, end product source that you can get in some of these foods. So that would be very helpful. Now, what about it? What about increasing K2 to help in the targeting of the calcium, so it goes into the bones and teeth rather than the soft tissue?
Yeah, that should help with, as a synergist with magnesium. So, yes, K2 would be beneficial.
What are you seeing particularly? And I'm just wondering if you've seen what I see. I have a lot of clients these days that are being diagnosed with lupus. Do you see any particular metabolic patterns with a lupus patient?
Yes, typically you would see lupus scleroderma. Again, that's the most common autoimmune condition that occurs in female, most commonly, and you see that with your typical slow metabolic patterns.
And so what would that mean in terms of minerals?
Well, they would have, high tissue calcium levels. And again, many of these conditions, are triggered. It could be genetic, obviously, but it could be triggered by an underlying virus. We've had people who have had multiple sclerosis-like symptoms, and typically you would see that in a fast metabolic type with low copper levels, but we saw several who had MS symptoms, and they were slow metabolic type with this very high tissue calcium level. And we found that they had an underlying viral condition because they had the high copper coexisting with it and the low zinc copper ratio. And they responded so dramatically with therapy. A true MS condition wouldn't respond that rapidly, but these people respond very quickly and by giving supplements to reduce the calcium and to reduce the copper and so forth. And what we found was they had developed or contracted a virus, and then the virus reached the blood-brain barrier, and that started producing the multiple sclerosis-like symptoms.
So do you think there could be a viral component to Alzheimer's, or is that in addition to a heavy metal load from aluminum, from mercury, or copper?
Yeah, it could be any of those. But I think if I were to categorize Alzheimer's, we see that commonly in fast metabolic types.
No, that's interesting. Fast metabolic types.
Yeah, and they're the ones with the copper deficiency, low dopamine levels, and the high glucocorticoids causing, a lot of the brain shrinkage and disturbances. But aluminum certainly is a factor. There is a dementia, over in Guam, that is related to high aluminum levels in the water. And so as you mentioned too, copper is a neurotoxin. Mercury is a neurotoxin, and that can certainly, contribute to a lot of neurological symptoms as well.
So with the Dr. Brewer information, I'm just trying to make sense of this. He's seen the Alzheimer's increase with the use of copper pipes. So that would then make a lot of the copper bio unavailable, thereby increasing the likelihood of a copper deficiency. How would that jive?
Well, I think that depends on the person. I have to go by the millions of tests that I've looked at, from the urinalysis standpoint. And I don't know exactly what test he used to come up with his conclusions there.
He used some of this. He took a look at the epidemiology of the people in some of the other countries where they instituted copper pipes early on, and it seemed to correlate with the increase of Alzheimer's. And so his hypothesis there was that there was a lot of inorganic copper which was not able to be used in the system, and therefore contributed to a copper toxicity, or rather a copper burden.
I don't know. Annalise, I don't know. I couldn't speak to those conclusions based upon the mineral analysis sometimes.
So what I'm trying to allude to is that if you have an excess of any of these minerals that can misbehave, so to speak, because they can go either way. They're a double-edged sword. They can contribute to a deficiency. In other words, if they're bio-unavailable, then they're not. If they're not organic, they become bio-unavailable, is what I'm trying to say. I think the same thing can be true of iron, for example.
Well, yeah, iron can certainly, excess iron can cause neurological symptoms too. Particularly we see that in people with ALS, interesting, amyotrophic lateral sclerosis. Interestingly, the other name is Lou Gehrig, and of course he was called the Iron Man. And we have found that association because it accumulates in areas of the brain, and it can cause aggression and motor disturbances.
So that's iron, you're saying? Iron toxicity or iron burden?
Right, excess iron.
And where's that? And how does one? Is that a genetic predisposition? How does one start absorbing too much iron?
Well, yes, it can be genetic, obviously, but it can be related to the copper deficiency. In other words, when you have a deficiency of copper, then you have a bio-unavailability of iron. You can't reincorporate it back into hemoglobin in the red cells that are being produced. So it goes somewhere. So it goes into soft tissue storage, right? And when it goes into the brain in excess amounts, then it affects, those two areas of motor control and emotions, and the amygdala and the substantia nigra, and it can cause aggression as well. So many people, just with a simple copper deficiency that they may have had all their lives, and it was exacerbated, then their iron will start building up over time, especially, if they're consuming, from high iron foods, cooking in iron skillets, drinking high iron water. Those factors will contribute to buildup of excessive iron, and that's associated with cardiovascular disease, arthritic, migraine headaches. A lot of symptoms can come from excess iron.
So you're alluding to something very interesting, Dr. Watts, and that is that there's an antagonistic relationship between many of the minerals. So you've spoken about copper and zinc, for example, iron and copper. Are there any other ones we should be mindful of?
Oh, yes. Sodium and potassium are two, and then, of course, zinc, copper, calcium, phosphorus. And then there's others that, we'll discover as we go along. Some of the other elements, that we test for, the additional elements, like, strontium goes with calcium, and rubidium goes with potassium and so forth. But, that's an area I don't guess we need to discuss right now. It gets a little complicated.
So when you do your tissue mineral analysis, I want to move into the analysis itself. When I see a readout from UniKeyHealth.com on a hair analysis for a client, you actually measure different ratios. Can you explain what that means and what that alludes to? Is there a glandular connection with those ratios?
Oh, yeah. See, I guess that's one thing we could say about the mineral patterns. It's not simply a reflection of diet. What controls those minerals is the neuroendocrine system. So a person can eat a lot of food with high concentrations of certain minerals in it, but yet they won't retain it because of their metabolic characteristics and the endocrine component of that control. So the mineral levels are controlled by the neuroendocrine system, and the important ratios between those minerals have to be maintained for optimum health. And so, yes, we can see the reflection. For example, if you just look at sodium and potassium, those two minerals, they work together. They typically go up and down together. And one's high, the other's high. One's low, the other's low. But when that ratio gets out of balance, let's say the normal sodium-potassium ratio should be around 2.5 to 1. Let's say you have a sodium to potassium of 10 to 1. In other words, the sodium is 10 times higher than your potassium. Well, that gives an indication that there's an acute stress response going on, and highly possible an inflammatory condition going on somewhere in the body. And then a low sodium to potassium ratio, say it gets down to less than 1 to 1, that can be related to a kidney issue, as well as a hormonal issue, excessive stress hormones or anti-inflammatory hormones. And then zinc and copper, gives us an indication, a pretty good indication of a person's hormonal status from the standpoint of in females. We can look at that relative to the progesterone and estrogen relationship or balance. And then in a male, the zinc would represent, testosterone, because you have to have, zinc is necessary for testosterone production. And of course, that's related to progesterone production in the female. And then copper is influenced by estrogen. And I'm not saying that copper produces estrogen, but estrogen influences copper. So when we see a low zinc copper or a high excess copper, that can be related to high estrogen from a, from a naturally occurring, say following pregnancy in a young woman, or it could be related to, estrogen birth controls, and or it could be related to copper content coming from intrauterine devices such as the CU7, which is a copper wire around plastic and inserted. And it's estimated that 20 to 30 milligrams of that is absorbed per year. So if a woman has an excess copper and they can't seem to get that down and they have an IUD, that needs to be replaced with some other form of intrauterine device.
So we see an inordinate amount, the imbalances that I see most of all in my practice and among my followers have to do with thyroid. Nothing pulls the way a thyroid post does. So tell me about the mineral imbalances that you typically see in a hypothyroid individual versus a hyperthyroid person.
Well, the major thing we see, as we mentioned earlier, how calcium is an antagonist, to the thyroid expression. It's also an antagonist to potassium. So we typically see a very high calcium to potassium ratio. The normal ideal ratio there is around 4 to 1. But we see people with 20, 30, 40 to 1. And that's indicating a pretty strong hypothyroid condition.
So again, it's the calcium. Could it also be a deficiency of potassium?
Yes, and or selenium. Selenium is important for thyroid function as well. And if it's related to a high copper level, then it could be an autoimmune condition, or Hashimoto's.
So we see an inordinate amount of all of this in this day and age. Is there something that you think has changed in the environment that's skewing some of these hair analysis results? And are you seeing different patterns of health today in 2020 than you saw maybe 10 years ago?
I think in general you could say that, Annalise, and I think a lot of that obviously is diet, how much is changing, how much fast food we have, and that type of thing. But I think also it's probably highly related to the medications that people are on. I think I read a statistic, and this was some years ago, people over 50 in general in the U.S., they're taking an average of 2 to 3 medications. And then when it gets to 60, age 60 and above, these people are taking an average of 4 to 8 medications. And those would impact, a person's nutritional status quite severely. And many people that are taking medications and that their nutritional aspect isn't even being thought about, from that perspective.
Interesting. I never even thought of it that way. Do you see any more aluminum? There's some thought that there's quite a lot of nano aluminum that's coming down from the air. Are you seeing more aluminum these days, more uranium these days?
Well, not so much in general now, because, we do tests all over the world, obviously. And but in the U.S., we do see areas of pockets, geographic areas where this group will have higher levels of certain elements than others. For example, with uranium, we see that in the rocky granite areas of the U.S. And, for example, in Maine, but even in the mountainous areas of California, too, we see much higher levels of uranium. And so compared to someone living in Florida or Texas, or, for example. Now, and you can get high uranium levels in the water supply, from agricultural runoffs as well. But the main issue with excess uranium is when we see that in a person, we suggest they have their home tested for radon, because uranium, ultimately deteriorates. It breaks down to thorium and then breaks down to radium, which gives off a radon gas. And we know that radon gas is certainly associated with cardiac, cancers and so forth. And so that's why I think anyone should have their home tested for radon if they have a high uranium in the area. But let's say, for example, all these granite
Counters.
Put tops on the homes. Many people fill a home with granite. You just wonder if they might want to have a radon test, just to rule out that those are not
transmitting radon.
No.
Interesting. I live in the Pacific Northwest. We have an inordinately high radon level here. I had to actually remediate my home, Dr. Watts, because of that. So I'm very attuned to it. We've also found uranium in our water.
Right. It's commonly found in the water. We've found that too. We've had many cases where we've told people from their test results that they should have a radon test done, and they actually found high radon. And obviously, you can remediate it, though. And then even if it's in the water supply, there's adequate filtration that can remove the uranium from the water, at its source, particularly if it's a well.
So when one does a hair analysis, and we're just about ready to wrap up, one takes, is it 1 or 2 tablespoons of hair from the nape of the neck, and why the nape of the neck?
Well, we suggest from the vertex, just above the ears all the way back to the nape, and from several different areas, so you get a representative sample. And then also it's to hide any cosmetic, you don't want to scalp someone and leave a hole in their hair. So that's the other reason for taking it from the nape.
Is it 1 or 2 tablespoons?
It's only 1.
Oh, so it's just a small amount of hair. So it's 1 tablespoon. And how frequently should one do follow-ups? Because you can't always see sequestered heavy metals that the body is so efficient at storing away to protect you. So shouldn't somebody do a baseline hair analysis, so to speak, and then 2 to 3 months later, if they suspect a heavy metal burden, take another hair analysis until you actually find what's being sequestered by the body?
Yes, exactly. From the first test that a person has, and if you put them on a therapeutic regime, to address that pattern or imbalance that they have, you'd want to follow up at least 3 months, and sometimes sooner, depending on the severity of the pattern, the age of the person, and so forth. And then you want to compare the two, look at changes that have occurred, those that haven't occurred, and then make the modifications accordingly. Because these mineral patterns are like peeling an onion, as we've said. You go to layer to layer to layer, and some things can show up that weren't there initially.
So do you typically find that after the second or third go around? In other words, you wait 2 to 3 months, and it's about 2 to 3 hair analysis later that you see something? Because I do. I never see anything on the first go around. Yeah,
that's possible. Huh? You may not see it for, after the second or third test. Yeah.
All right, and to wrap up just a little bit, is there anything else that people should know about why hair analysis is a much better barometer of your health than some of the other testing that's out there? What else do you have to say about this wonderful methodology, which is so non-invasive and relatively inexpensive?
That's exactly what I was going to say, Emily.
I read the script.
Yeah, it's a fantastic test. It is extremely economical, and it gives us so much data, from this one sample. I mean, we're looking at 30-something elements, and you can't get that anywhere. You couldn't do those in the blood, because it would be prohibitively expensive. And knowing the relationship between, minerals and vitamins, you can discern, a vitamin need right along with the mineral, if you know the cofactors.
It's so true, and that's why I'm so grateful that UNI KEY Health Systems at unikeyhealth.com has been offering your tissue mineral analysis as long as they've been in business, because I have been a spokesperson for this wonderful group, and it has actually been the test which I think kind of saved my sanity. I was diagnosed many years ago as a copper toxic or copper overburdened individual, and it's taken about 10 years to really get that in tow. So I have to thank you for all the wonderful work that you've been doing. I thank my sponsor, UNI KEY Health Systems at unikeyhealth.com, and I want to invite all of you to visit AnnLouise.com for more wonderful podcasts, articles, and videos. So we'll see you next time on the First Lady of Nutrition podcast, my friends. Be well, and thank you again, Dr. Watts.